Okay, so I chose the clinical practice guidelines for the rehabilitation of lower limb amputation, reviewed by me, Alyssa Ranyuk. So the purpose of the CPG, between 2015 and 2017, the U.S. Department of Veterans Affairs and the U.S. Department of Defense developed a clinical practice guideline for rehabilitation of lower limb amputation to address key clinical questions. The identified literature was evaluated and graded using the National Academies of Science grade criteria. Recommendations were formulated after extensive review. 18 recommendations were confirmed, with 4 having strong evidence and work group confidence in the recommendation. Key recommendations address patient and caregiver education, consideration for the use of rigid and semi-rigid dressings, consideration for the use of microprocessor knees, and managed lifetime care that includes annual transdisciplinary assessments. So overall, the CPG used the best available evidence from the past 10 years to provide key management recommendations to enhance the quality and consistency of rehabilitation care for persons with lower limb amputation. So I have a few pros and cons of the CPG. I'll start with the pros first. It's the most recent publication in a series of 3 guidelines related to the rehab care of people with amputations. It's used a structured development process to assure high quality and clinically relevant products. It provides a framework for managing people with lower limb amputation in the context of their individual needs and preferences. And overall, this CPG will help enhance the quality and consistency of rehab care for this population. Jumping into the cons, it was restricted to only 10 key questions and a 10-year period. And like I said, for the pro, that it was a series of 3 guidelines, I think it's also kind of a con because there's a lot to it. So something more condensed would be nice. So they mentioned that the CPG was very time-consuming and labor-intensive. And there was a large investment in resources, so it may be hard to replicate either within or outside of the federal sector in the future. All right, so jumping into the Agree tool. We'll start with domain 1, the scope and purpose. So the first one, I ranked it a 7 out of 7. I found most of the information on page 820 and 821. They did a good job explaining the health intent and patient population. They used PICOTS, population intervention, comparator outcomes, timing of outcome measurement, and setting for the CPG. In this format was to establish the scope of the literature review. For the second one, they did a good job mentioning the target population being the veterans, interventions, healthcare setting being the VA and Department of Defense, establishing guidelines determined by the Institute of Medicine, but they didn't mention any sort of comparisons. So for that reason, I gave it a 6 out of 7. And for the last one, they did a great job mentioning the target population, men, women, service members, the clinical condition being lower limb amputation, comorbidities, diabetes, vascular disease, but I gave it a 5 out of 7 because they didn't mention any sort of age range, or they didn't mention what populations were excluded or any in the severity of the amputations. Domain 2 is the stakeholder involvement. The first one I ranked a 5 out of 7. They did a great job explaining that they for their expertise, they used a panel of 5 co-chairs from the VA and Department of Defense to lead the panel of 5 physiatrists, physical therapists, prosthetists, occupational therapists, psychologists, surgeons, and nurses. The institution that they used was the Lewin Group and the ECRI Institute, but they didn't mention any sort of geographical location or the description of the member's role. I mean, it's kind of obvious that occupational therapists are, I mean, we kind of know what they do, and in what physical therapists do, what surgeons perform surgery, but I mean, they didn't take it any further than just stating what their expertise is. The next one, I ranked it a 5 out of 7. The methods that they used was a grade method, which stood for grading of recommendations, assessment, development, and evaluation. And that was used to assess and categorize the quality of the research evidence. And then in terms of the outcome or information gathered, the strength of each recommendation was determined based on the quality of the research evidence as well as the additional domains of the grade criteria. And I gave it a 5 out of 7 because they didn't mention strategy used to capture patients or public's views. And I think that's a pretty big piece of information to leave out. The next one was, I gave it a 7 out of 7. They did a really good job making sure everything was clear, and they had a clear description of intended guideline audience, description of how the guideline may be used by its target audience. So the guideline panel focused on the development of the new recommendations using the key question evidence review, but also considered without a complete review of the relevant evidence, the current applicability of the recommendations, included in a previously published joint VA and Department of Defense amputation care CPG. So domain 3 is a lot longer, so I'll try to summarize a little bit. For the first one, I scored it a 6 out of 7. They did a great job covering everything in this category. The only thing that I kind of nixed them on was they mentioned that the meta-analysis of fair or better quality, it wasn't really specific. And so for that reason, I dropped it down a point. The next one, they did a decent job overall, but they didn't mention language or context. I assumed it was in English, but again, it wasn't explicitly said. So for that reason, I gave it a 5 out of 7 for not being very specific in this category. The next one, I gave it a 4 out of 7. The study design included the body, included in the body of evidence, study methodology limitations, and they mentioned a bunch of recommendations and comparisons that were brought forward to the new guideline in revised format, but it didn't mention appropriateness or relevance of primary and secondary outcomes considered. I think that's a big piece that they're missing, so for that reason I gave it a 4 out of 7. The next 1, 2, 3, 4, I scored a 7 out of 7. You can see that I have page numbers and table references. The italicized were basically like some of the information that was in the Agree tool that I was looking for that I was able to find. And so that was all very straightforward and easy. The last one I scored a 6 out of 7. So the development of this type of CPG is also very time-consuming and labor-intensive. This large investment in resources may be hard to replicate either within or outside the federal sector in the future. So they didn't mention when the guideline will be updated, and for that reason, I gave it a 6 out of 7. Domain 4 was all 7 out of 7. They had a great clarity of the presentation. I was able to find page numbers and table 3 with a nice table laying out everything and doing a really good job in this area. Domain 5, applicability. I gave the first one a 6 out of 7. The barriers were not explicitly said. The second one, 6 out of 7. Again, there was no how-to manuals or solutions linked to the barriers. And then the last 2, I gave a 4 out of 7. They didn't mention cost information that was considered or description of cost information. And they didn't mention process measures, behavior measures, clinical or health outcome measures. Domain 6, the last one, the editorial independence, 6 out of 7. They didn't explicitly state that the VA or Department of Defense were sources of funding, but it was kind of assumed, but it wasn't explicitly stated. And then the last one, there was no conflict of interest that have been reported by the authors or by any individuals in control of the content of this article. So overall, I gave it a 6 out of 7. I would recommend this guideline for use, however, with modifications. And one of my biggest concerns is that the barriers should be clearly addressed. They could have gone into more depth about process measures, behavior measures, or clinical health outcome measures. Thank you for listening.